Hey, it's Aaron. I'm back. I know it's been a while. It was a very busy annual enrollment period. I haven't taken the time to come up here and distribute information as promised. However, I'm here now, and I just wanted to give you, as I say, some more information. Whether you're on Medicare or you're new to Medicare or you know somebody on Medicare, I'm going to provide some helpful information that can guide you, especially if you are deep into Medicare years and are having issues with whatever you have with Medicare, because Medicare doesn't cover everything, as we know. And, if you need me, reach out to me. You can shoot me a message or what have you. But I wanted to give you a global perspective on Medicare. Basically, there's four parts to Medicare: A, B, C, and D. And there's no plan that's perfect for everybody. This is why there are so many plans on the market, and they vary by county depending upon where you live. So this is a global discussion. The main things to understand about Medicare: Part A covers your hospitalization. There's no premium for it, providing you are fully vested in the Social Security system, and you get it when you turn 65. Part A does not cover everything in the hospital. There are co-pays and there's cost sharing, and the first day in the hospital has a copay, or what they call the first day deductible, of about $1,340. This is a big concern for most people. If you stay more than 60 days, there's other per day cost sharing, and it gets worse. So most people will have another plan with Medicare. Part B, you do pay a premium for, typically, depending upon income. You may pay more, you may pay less. The average is about $135 a month. Basically, it covers for doctors, it covers surgeons, it covers therapy, testing, durable medical equipment, a bunch of other services at 80% of what Medicare approves after a $183 deductible. That's for this year. It may change in the future. It probably will. So you're exposed to the 20%. You could be exposed to charges beyond what Medicare approves. Usually they're limited. And, just be aware that that 20%, we don't know what that could be. So most people, again, will carry something with Medicare to help offset or, mitigate those risks. I think the global decision that we have to make when we get there, or if we're already there, is, excuse me, would you rather have typically higher premium environment than the alternatives, and perhaps you have a program where there's no copays, or there's very low copays, and there's no deductible, or you do have a small deductible, but everything is relatively predictable. When you go to the doctor, or you have a test, or you go for surgery, or what have you, you're in the hospital. Some people like that. Some people want to pay what I think is typically more money than the alternatives that I'm going to describe in the future here. Some people like that, even if they don't have medical issues. They don't want to worry about it. They want to know, hey, everything's good. I don't have much to worry about if it's a Medicare approved service, and I am in a Medicare approved facility, or seeing a doctor who accepts Medicare. What do I have to worry about? Not a heck of a lot, in my opinion, if you have that robust configuration. These programs, I'm speaking of Medicare supplements, and they vary. I'm speaking of only specific ones. Plan F, it's a very robust plan, in my opinion. Keep in mind, you can go to any doctor. It doesn't have a network. Any doctor that takes Medicare, and there are some doctors that won't, especially here in New York City. You have these boutique doctors that they won't take any insurance. Doesn't matter what it is. So just be aware that there are some of those higher end doctors who you just have to pay, and there's no way around it. But if you find a doctor that participates with Medicare, these plans, are very robust, and you have the flexibility to go to many, many, many doctors and facilities. It makes life very easy. You do have to add a drug plan, because those supplements typically don't cover drugs, but as I explained in a previous video, there are ways to find robust drug plans. In New York, it can be relatively easy to get into one of these Medicare supplemental plans because they are what they call guaranteed issued. There are no health questions. There could be some waiting periods in rare circumstances, but there are no health questions. Unlike other states where if you have a health condition, it may be very difficult or in some cases impossible to get into a Medicare supplement if you have health conditions, unless you're new to Medicare, of course, and then you are in a special enrollment period or new to Medicare period where you can get in open enrollment period, you can get into a Medicare supplemental plan and not have to answer health questions. The alternative is, other than having what I'm considering a higher premium and adding a drug plan, would you rather be in a low or no premium environment and be subject to some cost sharing and co-pays if you enter the hospital, if you go to a doctor, if you're having testing or outpatient surgery, pretty much any service that Medicare provides. These types of plans, I'm speaking of the Medicare Advantage configuration or Part C, will have some cost sharing associated. They vary depending upon where you live. It's easy to research on Medicare.gov. However, many people will prefer or just can't afford any premium, and they'll have to go with either a zero premium or the lowest premium available, and they'll have to just suck up the cost sharing. If they go to the doctor, they'll have a copay, as I say, hospital, surgery, testing, ambulance, most of those services will have a copay, with the exception of preventative services. And usually those plans have drug plans built into them. They too can have deductibles because they have to mirror at least or be better than the Medicare Part D drug plan model. So these are the things to look at. With most of these plans, some of them are HMOs. You have to go to doctors that are in the network only, unless it's an emergency, of course, or urgently needed care. You go to the nearest place. Some of these plans are PPOs, where you have the flexibility to see doctors that are in network, or you can go to doctors that are out of network, providing they will bill the plan. And just be aware that there is more flexibility with those. Typically, if you go out of network and the doctor's willing to bill the plan, you have, generally speaking, a higher copay than if you remain in the network. So if you prefer that, many people do, they prefer a smaller premium, or they have to because they just simply can't afford anything, then you may want to consider one of these Part C plans, whether or not you need a drug plan. Usually they're built in, but not all plans have them built in. You can get them without drugs in case you have drug coverage through another source, a former employer, the VA, a previous union. Just be aware that if you don't get drug coverage and you don't have creditable coverage in place, that you may be subject to a penalty when you do get a drug plan. There are ways around that if your income is low enough, but that's beyond the scope of this discussion. This was just, as I say, the 10,000-foot view on what to consider. When you're looking at Part C plans, and as I said, they usually have a Part D plan built in, the things to consider are, hey, are all my drugs treated fairly in this plan? If you have a drug that's not in the plan or it's quite costly, this is problematic. You may want to consider another plan, or at least I would look to see what else is out there. If you're taking something expensive, Advair, Abilify, or make sure if you're taking Humalog or Novolog, make sure that they're treated fairly in the program. Because if not, it can be difficult to obtain that coverage. Check your deductibles, see what your copays are like, and also, check your doctors. Make sure that they are in the network. Of course, networks are subject to change at any time, but make sure they're in. You can go online and check out the plan. Usually on Medicare.gov, there is a button you can click to check doctors. You can also call the billing department at your doctor's office. Hey, do you participate with this plan? Ask the billing people, they know. And make sure you tell them the specific plan that you are taking or that you are on, because many companies have many different plans, and you want to make sure your specific plan is accepted at that office. So with those plans, they change usually annually, and anything can happen in the future. This year in the upstate New York market, we had a major insurance carrier leave the market with the majority of their plans, and it created quite a disruption. An awful lot of people had to find a new plan. This is kind of rare. I've seen it before. Just be aware that the possibility exists, and then you have to look for another plan. But that's the way she goes. There's no way around that. But every year these plans change. Sometimes premiums go up, sometimes premiums go down, sometimes cost sharing goes up, sometimes it goes down. It just depends on the experience of that plan in that area during that given year. A lot of those plans will add additional benefits beyond Medicare. Some will have some dental, some will have vision, some will add a membership to a gym. There's a variety of additional benefits that sometimes are available through those plans. One thing that you may want to consider is that if you have one of those plans, your cost sharing does have an out-of-pocket maximum. So if you reach a certain threshold in 2018, 2019, it's typically $6,700 in network. If you spend that much on doctors and hospitals, then you typically go into, they're going to cover everything for the rest of the year. That's Medicare approved. It's usually $10,000 if it's out of network, if you have out of network benefits. So those are some thresholds, but that's exposure that you may not have in the first environment, the Medicare supplement environment that I spoke about in the beginning of this video. So be aware of that. The major concern for a lot of people is if they have a Medicare Part C plan in most of the United States and they become ill. Let's just say, I'm going to make this up, let's say somebody is diagnosed with cancer and they need to go to the hospital or the doctor's office on a regular basis to receive chemotherapy. This is generally a Part B, as in boy, drug, not covered under Part D, as a dog. And the issue with that is on most of these plans, these Medicare Advantage Part C plans, you are susceptible to the 20% of the cost of that until you reach those thresholds that I just talked about, the out-of-pocket maximums. On most, or the good Medicare supplement plans, in my opinion, the good ones, the Plan Fs, you are not going to have that exposure. So if you are diagnosed with cancer or something similar where you're going to have those types of treatments, there are other reasons that you could have some exposure to the out-of-pocket maximum in a hurry. But if you do run into that, it may be difficult to move from a Part C environment into the Medicare supplemental environment because, as I say, in most states, not in New York, they ask health questions. And to get into one of those plans, it may be difficult, it may be impossible. Just be aware of that because it can, can be financially difficult to change things. In New York, it's not so difficult. It's pretty friendly, but it has been friendly there in here for many, many, many years. As I say, that's all I wanted to let you know about. I'll be back as frequently as possible. If you have questions, message me, post them here. I thank you for your time. My name is Aaron Baudet. If I can help, I'm happy to. Have a good day.